What is the difference between TRICARE network and out-of-network providers? Imagine you're seeking medical care through the TRICARE health program, which provides coverage for military service members, retirees, and their families. As you explore your options for healthcare providers, you might notice two categories: those within the TRICARE network and those outside of it. Understanding the distinction between these two types of providers can help you make informed decisions about your healthcare and maximize your benefits. TRICARE network providers are healthcare professionals and facilities that have entered into agreements with TRICARE or its managed care contractors. These agreements typically involve negotiated rates for services, which often result in lower out-of-pocket costs for beneficiaries. When you visit a network provider, your TRICARE coverage is usually at its most comprehensive, and you may pay only co-payments or co-insurance based on your plan. These providers are also more likely to have experience working with TRICARE and understanding its specific requirements, which can streamline your care experience. On the other hand, out-of-network providers are healthcare professionals and facilities that do not have a formal agreement with TRICARE. If you choose to see an out-of-network provider, your coverage may be different. You might be responsible for higher costs because TRICARE may only cover a portion of the expenses, or in some cases, may not cover the services at all unless certain conditions are met. For example, if you are enrolled in a TRICARE Prime plan, you are generally required to use network providers for routine care to receive the full benefits. Visiting out-of-network providers might involve filing claims manually, and reimbursement rates could be lower, resulting in higher out-of-pocket expenses. It is important to note that some services may only be available through specific providers or facilities within the network, especially for specialized or elective care. Additionally, emergency services are typically covered regardless of whether the provider is in or out of the network, but it is always advisable to verify coverage details beforehand to avoid unexpected costs. In summary, choosing a TRICARE network provider usually offers the advantage of lower costs, simplified billing, and providers familiar with TRICARE procedures. Opting for an out-of-network provider might lead to higher expenses and more complex claims processes, but it can be necessary if the required care is not available within the network. Being aware of these differences helps you navigate your healthcare options effectively and ensures you get the most out of your TRICARE benefits.